The National Adrenal Diseases Foundation, along with Medical Director Dr. Paul Margulies, would like to take a moment to answer frequent questions we receive from newly diagnosed patients with adrenal insufficiency. How often is it recommended for someone with primary adrenal insufficiency to see an endocrinologist for follow-up? And what additional testing is recommended at follow-up? Once a diagnosis of autoimmune adrenal insufficiency is made and replacement hydrocortisone and fludrocortisone is prescribed, frequent follow-up every 2 to 3 months is recommended until you are comfortable that the dosages of both medications are optimal. It is important to have face-to-face meetings with the endocrinologist. The doctor should look for signs of persistent adrenal insufficiency as well as overtreatment on the physical examination, as well as detailed questioning about symptoms, including fatigue, dizziness, nausea, and salt craving. Blood studies should include electrolytes, but also plasma renin to help establish the appropriate dose of fludrocortisone. The dose of hydrocortisone should be the lowest dose that prevents signs and symptoms of adrenal insufficiency. Once there is stability, it's best to have a face-to-face meeting every 6 months. There should be a physical exam and discussion of adrenal symptoms and intercurrent other medical history. There should be a discussion of management of any acute medical events and whether appropriate steroids were given. There is no benefit to repeating blood tests for cortisol, ACTH, aldosterone, or adrenal antibodies. It is best to use the lowest replacement dose of hydrocortisone that prevents signs and symptoms. If there really is some recovery of adrenal reserve seen in a minority of patients, it will be apparent by allowing a fairly low dose of glucocorticoid. There is no need for routine repeat of the entire diagnostic workup because it has a very low yield of useful information. Routine retesting for other autoimmune endocrine conditions is recommended, especially thyroid disease and vitamin B12 deficiency. Make sure your endocrinologist is advised about any new medical diagnosis and treatment from other doctors. Make sure you are familiar with appropriate emergency measures for acute illness and injuries. For more information, visit nadf.us or please send any additional inquiries to the National Adrenal Diseases Foundation, P.O. Box 95149, Newton, Massachusetts 02495, or call 847-726-9010 or email us at nadfsupport@nadf.us. NADF has support groups all across the country where you can connect and learn from others. Together, we can help bring about awareness, support one another, and help make the world a better place for those of us living with adrenal disease, one day at a time.